Curious about your MRI results and what it all means? Today, I'm going to talk about my most recent MRI results and how neurologists use MRI results in treating RMS. Hello, my dear friends, and welcome. My name is Vicki Hadge, and this is Even So, It Is Well. On this channel, I share my thoughts about living well with chronic illness. This does not mean that my thoughts are necessarily going to agree with your thoughts, and it also does not mean that my thoughts are medical advice. It just means that I'm thoughtful. I must stress today that my thoughts are not medical advice. If you have questions about your MRI results, please speak with your neurologist or your MS nurse. Today's video is for information purposes only. One of the things that I encourage in my videos is for us to remain curious about our health, our diseases, our treatments, and how we can live well with our conditions, because I think information is power. And I'm also a geek. I love data and information, and I really enjoy searching for and learning about new things. Today is going to be all about MRIs. When we get our MRI reports back and we're talking with our doctors, there's a lot of information. I mean, a lot of information in terms that are used that we might not be familiar with. And sometimes we have 15, maybe 20 minutes with our doctors, and that's not a lot of time to go in depth of what it all means. These are just some of the terms used to describe the results of MRIs when you have MS. NEDA, T1, T2, post-contrast, hyperintensities, hypointensities, lesions, plaques, bright spots, and black holes. I recently had my yearly MRI of my brain and my cervical spine, and I won't keep you in suspense. Good news! The results reported back from the brain scan indicate stable multiple sclerosis plaques. There's no evidence of change since a prior study. And the cervical spine report said stable appearing demyelinating plaques throughout the cervical and proximal thoracic cord. No new findings. Hooray! And at my appointment with my doctor, she said, "You have NEDA, no evidence of disease activity," the first and most sought after term in today's video. NEDA means that when they look at the MRIs, they don't see any new activities and your disease is stable. So let's dive in. MRI stands for magnetic resonance imaging. Huge magnets are used to get amazingly detailed images of our brains and spines. But what they are to me is noisy, they're scary, they're uncomfortable, and they are certainly anxiety producing because I have claustrophobia. If you would like to hear all about my claustrophobic panic attack and how I deal with my claustrophobia, you can watch this video here or this one, and I will put links in the description below if you would like to watch them later. Despite my anxiety and claustrophobia, I know that MRIs are also very necessary. Our neurologists use the information shown in the MRI as a tool to help with diagnosing MS, help determine if we're having a relapse, to see if there's disease activity that we might not be aware of, and to determine if our DMT, our disease-modifying therapy, is working. It's the most sensitive tool that they have to monitor our MS. So let's talk about what's shown in the results. Oh, and all of the images that I'm showing today are of my brain, so you get a peek inside my head. Here's a tip. You can request copies of your MRIs. I highly recommend doing this for two reasons. If you ever need to change doctors or hospitals, it's much easier to have copies that you can show them and that you can give them. Sometimes there's a lot of red tape in transferring from one doctor to another. And I also like to review my images before seeing my doctor. That way, when she's showing them to me and I am familiar with the artifacts already, I can ask questions if needed. Let's start with T1 versus T2. This refers to the type of imaging. An easy way, well, easy for me anyway, to remember this is that the T2 images show H2O, water or fluid, as hyperintense. It shows it as brighter or white. So T2, H2O. Where there's a lot of fluid like spinal fluid, you will see brightness. Gray matter, like in the cortex, the outer covering of the brain, has more fluid in it, so it will be brighter than the white matter, the more middle of the brain. I know it can be confusing, right? Feel free to pause the video at any time so you can take a closer look at any of the images. White matter, on the other hand, is rich in myelin and it is rich in fat, so it has less water. White matter will show up brighter, hyperintense, on T1 weighted images, and areas with more fluid will be hypointense, darker on T1 images. If you have an area that is normally full of fluid, it will show up as a bright spot on a T2 image. This may be a hole from previous damage or just an area where fluid is in your brain or spinal column. Contrast enhancing images show where the dye is showing. These areas will show up as bright spots on T1 post-contrast images only, and the fluid spots will be dark. Here's an example of a T2 image and a T1 image post-contrast. I have a hole, brain damage. Don't worry, I've got plenty of reserve from a previous lesion. In the T2 image, the hole shows as bright. In the T1 post-contrast image, it shows as dark, but there are some bright areas where there may have been dye leaking. So let's talk a bit about black holes. These are areas of more severe tissue damage. This is an area where the tissue, the myelin and the nerves, were more heavily damaged, and it's now a black hole. These are indicators to our doctors that may put us at greater risk for physical disability. Lesions or plaques. Lesions and plaques are sometimes used interchangeably. They're spots that show disease activity, areas of inflammation and demyelination. They show what has happened in the past with our MS, what's happening now, and can possibly predict what's going to happen in the future. They can show old damage and new damage, and they can also show up as we age due to other reasons, such as blocked blood vessels from smoking or high blood pressure. Not all visible lesions are associated with symptoms, so it's important to let your neurologist track your lesions. You've heard it said that location is key. Location, location, location. Lesions due to MS can be in the brain, the spinal cord, or on the optic nerves. Spinal cord lesions tend to cause more symptoms in your extremities, in your arms, and your legs. Lesions at the base of the brain, in the brainstem, can cause vertigo, double vision, and balance problems. Cortical lesions, lesions that form on the cortex, the outer covering of the brain, are sometimes harder to see on standard MRIs, and the lesions are more of an indicator of progressive MS. Lesions on the optic nerves can cause disturbances in vision or temporary blindness. Lesions in the brain can sometimes go unnoticed because our brains have a lot of reserve, especially when we're young and before atrophy starts to shrink our reserve. They may also contribute to more cognitive fog, foggy thinking. Atrophy, brain shrinkage. Everyone's brain shrinks as we age, but most of us with MS see faster rates of brain shrinkage, up to 10 times faster. While this is hard to measure on MRIs, changes can be seen over time, and they're still developing new methods and software so they can accurately measure it. Final thoughts. You may not get MRIs annually. Your healthcare provider may not recommend them annually for a variety of reasons, such as the type of MS you have, benign, relapsing, remitting, or progressive. So please don't go to your doctors and say, "But Vicki gets hers every year." Please do speak with your neurologist and MS nurse about your MRI frequency and the results, though. Thank you so much for watching today. If you enjoyed this video, please give it a thumbs up, a like under the video. And if you've not subscribed yet, please hit the subscribe button and the notification bell so you don't miss any of my upcoming videos. The question of the day is, do you feel like you know your MRIs? Do you discuss them with your doctors? Please put your answer in the comments below. I love getting to know our MS community. Take care.